Well, the coronavirus is all over the news, and pieces. Well, we've got the Delta variant. There's this Lambda variant that they're talking about. The COVID passports, herd immunity, all kinds of things, all kinds of questions being raised. New York City, by the way, Mayor Bill de Blasio just announced that city workers must be either vaccinated or submit to a weekly COVID test. Period. He's drawing a line in the sand. Dr. Eric Feigl-Ding is with us, the epidemiologist and health economist. He's an adjunct fellow, senior fellow at the American Federation of Scientists. FAS.org is that website. I follow him on Twitter, where he's just been one of the most informative sources for COVID information. His Twitter handle is Dr. Eric Ding, DRERICDING. Dr. Feigl-Ding, welcome back to the program. It's always nice talking with you. I'm wondering first, or curious first, about your thoughts on these 50-plus healthcare groups, including the American Medical Association, American College of Physicians, American Academy of Pediatrics, American Public Health Association, who are all calling for vaccine mandates to keep your jobs. What do you think?
Yeah, I think it's a good idea. Look, they chose their profession to take care of other people, to protect the health and welfare of other people. This is a choice of theirs to take that job and to serve others and ensure health care. And so with that in mind, I think requiring vaccinations among these people to A, protect themselves so that we have a healthcare workforce, and B, so to reduce transmission, eliminate transmission as much as they can from spreading to their patients, it is absolutely incumbent that they do this, and I think it's a great move. And I hope many organizations follow. Yeah, amen.
I agree with you, but what would you say to those folks who, as I had my last caller in the last hour, who called up and said, now, Hartmann, you're being the bully here. You're bullying me into getting a vaccine that I don't want to get, and I feel bullied, and I don't think that's right, and, quack. What do you say?
Well, this is what I'm saying. They signed up for this job. Firefighters who sign up for that job have to take a lot of protective equipment, the training. They are mandated to wear helmets. Those are things that comes with the job. Certain jobs have occupational requirements for safety and to protect others around you, and they chose that job. So this is not like a blanket requirement for every single person. This is a job for that high-risk occupation, just like any other hard workers in construction sites have to wear hard hats. Right. This is absolutely needed to protect their health and protect public health.
So if we expand that lens to, for example, all the city employees in New York City, I think it's like 300,000 people, 340,000 actually, city workers, who didn't sign up necessarily, people who are collecting trash off the streets, or people who are writing parking tickets, or, people who are working in an office where they're processing paperwork, did not sign up to be public health workers or physicians. Should they be required to be vaccinated as an issue of public health, as a condition of their employment?
First of all, they are public servants. They serve the people of New York City. They are not their own private, self-employed individuals. So they have to follow the government policy mandates on that. And again, most of them are public-facing in some way. And also, by the way, the New York City policy, remember, still gives you an out. You can test negative once a week, although once a week is still very lackadaisical, but you can test negative. And by the way, the mandate recommendation from these 60 organizations, it allows for medical excuses as well. I just want to point that out. But again, New York City employees are public servants, public taxpayer-paid employees. And again, there is another out for them if they want to test negative every week.
So to take the lens all the way out, or maybe a little larger, actually, it's still not all the way. What about, I am one of these people who has Clear, this system that you can use to go through airports really fast. And they now have a vaccine passport. And I signed up for it over the weekend. And I now have a vaccine passport on my iPhone that is via Clear, by this company, and you know, the airlines all use them, and so we've got a nationwide system now. Now that you have to pay for that one. The CDC has one. It's called V-Safe. If you just Google V-Safe, you get the page for it, and they've got everything. You put your data in. I did. And it sends you back what looks like a vaccine passport. The one step that they haven't, this one switch they haven't flipped, is to turn it into an app or put it, you know, as an app so that it works on your phone, which would be a fairly small thing. So what about requiring proof of vaccination via one of these methods to come into a restaurant or a bar or a retail establishment or a theater?
Yeah, that's actively proposed, and in many countries have already been implemented. In many countries in Europe, not the most famous of which was France. They implemented this, and overnight, literally 3 million people signed up for vaccination in 3 days. So we know that this could be extraordinarily successful, and I think the U.S. needs a verification system because we know there's lots of fake vaccine cards roaming around. You've heard those stories. You've seen.
Oh, I saw them for sale on Amazon,
eBay, and prosecutions. Yeah, I know. So I think a verification system is needed. The issue is, of course, you know, some organizations will enforce this, some will not. Some parts of the country will comply, some will not. But I think in certain ways, we've tried every single carrot out there to get people to vaccinate. And now Delta variant is surging. Delta variant is 4 times more deadly if you're not vaccinated compared to the original strain. It is twice as contagious. So this is why we really, really need to clamp down. We've used every stick in the book, used every carrot in the book. I think we have to start using sticks now because this is to save people's lives and also to protect our children, which are not yet eligible for vaccines. So I think in certain ways, if we want to protect our future, you know, we mandate helmets, we mandate seatbelts, and mandate airbags. It's not taking away your freedom. It's to protect our future generation.
Right, which in a way is protecting freedom itself. I mean, you know, the freedom to associate, the freedom to live in this country. We're talking with Dr. Eric Feigl-Ding, epidemiologist and health economist and an adjunct senior fellow with the American Federation of Scientists. Dr. Feigl-Ding, the Delta variant, I've been following this over at Outbreak.info, where they do a really nice and graphic job of tracking which variants are extant in which countries, you know, under what circumstances, or even states. And the Delta variant has just, you know, it's just subsuming large chunks of the world. But now there's this Lambda variant. What do we know about other variants beyond Delta, and what do we fear? You know, what's the concern if we can't get this thing under control to the point that there's not a large enough reservoir of humans infected with it that it continues mutating?
That's a good question. There's always a lot of variants, but the more warm bodies, as I call it, we give the virus, the more it will learn to adapt to our bodies and adapt in potentially more contagious ways, more severe ways, more immune evasive ways. And this is why it's a cat and mouse game. But there's a way to end this cat and mouse game earlier, and that is by vaccinating and going for zero COVID with masks, ventilation, air disinfection, better quarantine. All these things, in addition to testing, work. They work, but they work best when you slam the virus down to zero and not give the virus millions of more warm bodies to replicate. Lambda is just one potential risky one. There's Delta Plus. There's actually 2 types of Delta Plus now. That's actually kind of scary. But in certain ways, we're going to play whack-a-mole unless we take a whole-scale approach to stopping this pandemic, not just piecemeal, half-ass kind of approaches, because in certain ways that will just give the virus more time to replicate and practice and learn to adapt to us.
You know, back in the as air conditioning started spreading across the South, it really led to the growth of the modern South. And what they found was that in a lot of these systems, you know, constantly circulating air and building sealed buildings, basically, which was a thing back in the 60s and 70s, they discovered that people who were prone to things like asthma was problematic for them. So they started building air filters, simple air filtration systems into home heating systems and into office building systems. Now they have these filters that have ultraviolet light in them that are capable, that kills all the virus that travels through them. Are you suggesting that this is going to be the new normal, that this is going to be the next big thing in building construction and building maintenance and upgrades that we're going to start developing? I mean, the building we're in, for example, has an air system that's got filtration, but it doesn't kill viruses. So, the guy in the office next to me is sharing air with me, which is a little concerning.
Yeah, and I think as we exit this pandemic, hopefully soon, and prepare for the next winter wave and other future years, we have to completely redesign and reimagine our buildings. The hermetically sealed buildings with poor ventilation, those are out. The buildings in which you can't open windows, and the buildings which don't have any air filtration upgrades, you need MERV 13 filtration. You need UV light disinfection in your HVAC. And for larger rooms, you need potentially HEPA filters if you can't open windows or if your HVAC system is outdated, as well as upper room UV GI, which is it's not UV on your skin, but UV near the ceiling. And as the air circulates up, it gets zapped and disinfected as the air circulates. And that is, in fact, is one of the most effective ways to disinfect. We have to rethink our entire building structure. Just like we have to rethink and remove lead pipes, we have to remove hermetically sealed, ventless. Have to think that as population density grows, as our modern workforce works inside rather than in the fields and farms, we have to think, how do we prevent the next pandemic, and how do we prevent future super spreading events?
Absolutely brilliant. Dr. Eric Feigl-Ding, epidemiologist and health economist, adjunct senior fellow of the American Federation of Scientists, FAS.org. You can follow him on Twitter at Dr. Eric Ding, DrEricDing.
This is the Thom Hartmann Program.
Whoa, where'd that come from? We'll be right back. Dr. Feigl-Ding, thanks so much for dropping by.
Thank you.